With the vaccination of children aged 5 to 11 seeing delays, how can government address vaccine concerns among parents? We have with us Pediatric Infectious Disease Specialist Dr. Andrew Camposano. Good evening, Dr. Camposano. Welcome to The Big Story.
Good evening po.
Doc, let's start with what we know about the vaccine specifically for children, specifically for this age group, 5 to 11. What do we already know for certain in terms of safety and in terms of efficacy?
So based po on the data that was done by Pfizer for their vaccine and the data also gathered by the United States and based on the children that were given vaccines there starting last year, the vaccine is safe. So the side effects are minimal. And in terms of weighing the risks versus the benefits clearly outweigh the risks. So the benefits include preventing infection, preventing severe disease, and also in a way, it helps us go back to what we have been doing before the pandemic, especially for the children.
You talk about going back to the time before the pandemic. We can even go back to the start of the pandemic. Marami na po kayong nakitang mga bata, nakatrabaho mga bata. Siyempre, marami rin kayong nakakasamang mga parents. At the start of this pandemic, we did have to deal with vaccine hesitancy among adults for themselves. Sa experience niyo po ba, talagang iba ba ang vaccine hesitancy when it comes to a parent trying to look out for their children? Iba ba yung fear for yourself? Iba ba yung fear for your own child?
Actually, siguro for every doctor, paiba-iba yung experience. Pero based on my experience, mas gusto ng mga parents pabakunahan yung mga bata kaysa sa pabakunahan yung sarili nila. Or yung mga lolo at lola, actually parang sila nga yung medyo mas may hesitancy kumpara sa ipapabakunahan na nila yung mga apo nila. That's my experience. Pero meron din syempre iba na parang mas gusto nilang protektahan yung the little ones. Pero I think the DOH has been doing a good job in terms of giving information and countering vaccine hesitancy in the country. And I think this has been shown in the increasing vaccine rates in the country. And as well as yung nakikita din natin na the success speaks for itself, that we have been able to decrease the numbers in the country, and the Omicron surge did not cripple the health system as much as in the previous surges, which can be attributed to vaccination.
Interesting po yung nabanggit nyo, yung mga lola, for that matter, the entire extended family, pati mga tito, mga tita. How does that come into play, especially with the culture of the Philippines, particularly if a household, yung parents ang ayaw, how can everybody else help each other to be convinced about this?
I think important po na kung sino man yung, syempre depende din sa family dynamics ng isang pamilya. Depende kung sino po yung main decision maker. Tapos kung meron po siyang mga doubts, pwede po siyang magtanong sa kanyang trusted na healthcare provider. Pwede po magtanong sa doktor nila, or for example, kung sa mga kababayan natin sa mga malalayong lugar, nandiyan naman po yung mga DOH personnel like midwives, BHWs na may knowledge din na pwede silang mag-share tungkol sa benefits ng vaccination. So yun pa, sino yung pinaka-main decision maker siguro sa pamilya, kung meron man siyang doubts, ask the health expert na kilala nila.
Okay, Doc, maraming salamat po. That was Dr. Andrew Camposano, Pediatric Infectious Disease Specialist.